Hi, everyone. Welcome to the OnPoint podcast. Today, I had my friend Stacey Gorski, head of medical excellence for the U.S. Oncology medical affairs team at AstraZeneca, join me on the show. We got to focus on something really important, which is onboarding in medical affairs. We talked about how it can improve retention and how to maintain engagement with new employees. I really enjoyed this conversation, and I'm sure you will too. Welcome to OnPoint, the medical excellence podcast where we talk to pharma leaders about how to build highly effective medical affairs organizations. All right. Hello, everybody. Welcome back to the OnPoint podcast. For those I haven't met, I'm Scott. We are digging into a really important topic around onboarding new people into medical affairs. And today I am thrilled to have my friend Stacey Gorski joining me. Stacy has 5 years of experience in medical excellence. She's currently the head of medical excellence for AstraZeneca for the U.S. Oncology medical affairs team. And of all the things that Stacy does, when we were talking about this session, she said, I want to talk about onboarding because it's so important, so critical, and a lot of people have challenges with it. Stacy, welcome. I'm so glad that you are here with us.
Scott, thank you. And thank you for having me. I feel like it's such an honor to be on a podcast with you, talking about medical excellence. There's so many things and so many people you could talk to. I am grateful you chose me.
It's going to be so much fun. Everybody who's listening, you're in for a treat today. Stacey is an expert in her area, and I've had such a privilege working with you. Stacey, why don't you just give everybody a little bit of context about your medical excellence journey, why you're in medical excellence, and a little bit about kind of what your medical excellence team does.
Okay, sure. So I'm a scientist by training, got my PhD in immunology, and started out the traditional academic route as an assistant professor. And I was just telling the story the other day to somebody. I think it was one of my students that introduced me to the role of an MSL. And I thought, that sounds like a fantastic thing to explore. And so, as many things in life, pure luck and a little bit of hard work, was able to get my first MSL position with Sanofi Pasteur. Phenomenal experience, really learned about medical affairs, the importance of all the roles, including the MSL, but also headquarters. And then made my way into medical excellence through training. So maybe a little bit of foreshadowing of our discussion to come, but starting in scientific and medical training, and then very quickly establishing medical excellence and what was then medical excellence and strategic projects. And then, as you said, then moved over to AstraZeneca as the head of medical excellence, and certainly can get a little bit into that story because I think it speaks to the need that medical excellence fills. But just to quickly get to the end of your question of what our team does at AstraZeneca, we work for the U.S. Medical Affairs Department, and I'm specifying that because it is a very large department. We have several different what we call franchises in our oncology group, and our medical excellence team supports all of them in the areas of digital innovation, medical education, onboarding and capabilities, omni-channel, and a myriad of other processes, governance, and support.
Wow. Just so everybody has an idea kind of on that size and scale, how many MSLs as an example are across the entire franchise there?
For the US, we have over 100.
Wow. Excellent. And it's great. I love that you came from training. My background's in training also. I was in training and development. And I find that training professionals become really great medical excellence leaders because oftentimes it's not until you stand up in front of somebody and go, wait, you want me to explain the process this way? Or wait a minute, that doesn't make any sense. I can't say that to everyone, that you go back and fix it. And so I love seeing training leaders move upstream into actually designing the solutions and processes and technology that we then have to teach. And I think it's a really great fit for a place for training leaders to go to.
Thank you. Yeah, I could not agree more because we've all had that experience of sitting in a classroom and having somebody give that didactic lecture, maybe just looking down at their slides, and you could not have learned less or think, God, this is such a waste of my time, because the person just thinks, I'm going to crack open my head and dump all my knowledge and you're going to receive it. And so I think training professionals, at the very least, or somebody that has an education background, recognizes that it's not just about the information, it's about making it fun interactive, and pulling in some assessment pieces, helping people reflect on what they're learning.
Awesome. Let's jump in because you just gave us a big list of like so many things that you're responsible for. And you've got a great team. But out of all of those things, why onboarding? Like, why is this topic so prevalent and so important for medical excellence?
It's a great question. I'll say, number one, just reveal my bias. Obviously, I just am passionate about it. But number two, you're right. There are so many exciting things, particularly in this day and age, to talk about digital innovation, omni-channel, and all the fun and exciting things that are in that realm. But what I have found is that with onboarding, it's such a foundational piece of what we deliver in medical excellence and so critical. Particularly, I'm thinking for AstraZeneca, we are a growing organization. We have a red hot pipeline. And the idea of bringing in the best talent and then just saying, you figure it out, could not be more disastrous. So the timing and the importance of onboarding, at least for me, and I'm assuming some of your listeners are probably in a pretty similar spot, is the reason I said we got to talk about onboarding.
Awesome.
It's not the sexiest topic, but it's one of the most important.
Yeah, it's so foundational, right? Things that start well tend to go well, and things that don't start well don't often get better. So the more we can do upfront to make sure people are successful is so important. So let's jump in. What is onboarding? I know this sounds very basic, but there's so many different definitions. So many people might not have come from the training side into medical excellence. So maybe just walk us through when you say onboarding, what does that mean to you?
It's a really great point because you're right. There's a lot of different elements. And I think if I had to guess, when most people think of onboarding, they think of day zero, the start date of the new hire, and maybe a few days after. For me, onboarding is the moment the offer is accepted. And the reason I say that is because in our department of medical excellence, as soon as we know that a new hire is coming on board, it starts a cascade of what I'll call pre-onboarding, although that's probably confusing. Let's say pre-start date.
Yep.
Where we want to make sure we're having communication with the manager and most importantly, communication with the new hire. All of us have accepted a job offer. And in that moment, you are at probably peak excitedness. You've gone through this huge interview process. You've achieved your goal. You're excited to get started and you are probably on an emotional high. And so for medical excellence, that is a great opportunity to capitalize on. And so we ensure that communication happens with the new hire. Welcome to AstraZeneca. We're excited to have you be part of our team. And even just to say, we know that you're starting August 1st, and we'll be communicating with you in the days leading up to that to make sure that you have everything you need. Such a small thing, so important.
Yeah.
So step one. Then certainly day zero or day one is certainly an important day when we talk about onboarding, but I would say 90% of that's really in HR and IT's realm where they're making sure they have the equipment that they need. But that 10% where medical excellence can step in is also huge. Again, peak excitedness. You're coming in, it's your first day, you're getting all these fun things. And so being able to make sure that the manager welcomes the new hire, that they hear from a mentor, if that's an important piece of your program, and then also for medical excellence. Again, just to feel welcome and supported. And then for medical excellence, when we typically talk about onboarding, the biggest lift is in the 2 weeks post day one. So that's making sure that they're getting up to speed quickly, and we can dive into that.
Okay.
But again, just to re-summarize, the key pieces of onboarding is, we'll say pre-day one, day one, post-day one.
Love it. And I love that concept of the moment of peak excitement, because there's this element of you're really excited. I want to capitalize on it, but I'm also making a pretty big bet, right? I'm choosing you as much as you've chosen me, and I need to validate that decision as quickly as I can.
That's such a great point. And you hit the nail on the head because you're right. How nice is it? Because typically I would say in the interviews that I've participated in, oftentimes candidates are asking, what's your onboarding like? Because they want to make sure that they're set up for success. And so to really help them say, okay, what I heard in the interview is now coming to life. You're right. Is so validating. I had not thought of it that way, and you're spot on.
Awesome. I want to kind of go into those three elements, right? So the pre-offer, the offer to pre-arrival, kind of that first day or two. And then really what's in those next few weeks? And how is that program designed?
We have a person dedicated to onboarding. And so that pre-day one, I'll call it, is managed by them. And you've hit the nail on the head as far as process. A lot of this is project management. So also if any of your listeners have a great project management team, this is also a good opportunity to capitalize on their skills, because you're going to hear from HR that you have a new hire, you have the start date, and just like launch planning, you know when the launch date is, and so you have all kinds of planning leading up to it and all kinds of planning leading after it. The same is true for onboarding. So we have a person dedicated who's going to start the process of communicating with the new hire, communicating with their manager, identifying a mentor.
Okay.
At the same time, HR is running their own process, because you can imagine HR's asking the new hire, we need all the paperwork and all these kinds of things. And oh, by the way, you're going to have new hire orientation. And so that is day one, where the new hire is going to get their IT equipment. They're going to be introduced to the company, and they're going to be introduced to benefits and all those sorts of traditional, I think, orientation things that we think about. And I'm being intentional about the word orientation because, to your point, that's not onboarding.
Okay.
Orientation is the realm of HR and IT to say, here's the basics, high level. Doesn't matter if you're medical affairs, commercial, or manufacturing. This is what everybody needs to know about AstraZeneca.
Okay.
So now to get to the meat of your question, what happens after? What we plan for is day zero is largely dedicated to HR, IT, and then also that communication from the manager. That's critical, to have some time set aside in the afternoon for the manager to welcome them, say, how was HR, IT, anything else I can help with? This is a person where your relationship as a new hire is really important.
Mm-hmm.
So you want to make sure you hit it off on the right foot.
Okay.
Day two is where medical excellence steps in. We then have a medical affairs orientation. So if you think of HR, IT orientation, very broad, applicable to anybody in the organization, immediately we start getting very focused then on day two of, here is US medical affairs. Here's how we're structured. Here's our main hub page where you can find a lot of information. But by the way, I'm the onboarding lead, starting to put a face. And if you have any questions, I'm somebody you can reach out to.
Okay.
Thereafter, for the next 2 weeks, we do an orientation program. I'm going to stop right there, where you do an onboarding program. An onboarding program that ensures that our new hires are set up for success. And I know we're going to get to this later, but one of our key measurements is time to productivity.
Okay.
So making sure that our new hires know what the structure of the organization is, what are the key processes, and where to find information when they're ready to dig in.
And so let's just tackle that now. Time to productivity. How do you know what the finish line is? People that are in MSL roles, as an example, a year later are still learning things. So where do you draw that finish line for onboarding?
We tend to do 3 categorizations of new hires. You're somebody that comes in with pharma and medical affairs experience. So obviously your time to productivity is probably going to be a lot shorter than somebody who's in our third bucket, which is no pharma, no medical affairs experience. Okay. And then the second bucket being you've had pharma, but maybe this is your first medical affairs role. So in that case, we had to start off with a baseline. So if anybody is listening and you're just starting your onboarding program, the key for you right now is data. Just start collecting. What is the baseline before you implement an onboarding program? We asked new hires and managers to how long do you think it took yourself if you're a new hire? Or managers, how long did it take your new hire until you felt they were able to execute the job without, I would say, high level of oversight?
Okay. Yeah. So when you first started and asked those questions, how long was the time?
So for our field folks, the average time was a little over 4 months.
So then you put a program in place. And
we have actually just recently did that same survey. So again, this is, you could argue, a bit qualitative, but asking folks, same thing, managers and new hires. And we were at a little over 3 months. for field.
Okay.
Yep. I can't recall the numbers for HQ. They tended to be a little bit shorter, and that's to be expected. Our field programs, and I know we're going to dive into this, they tend to have a lot more structure around their onboarding program as far as scientific training goes. Whereas HQ, and hopefully we can use this as a jumping off point, because one of
Yeah.
our challenges for HQ roles is there's not a lot of structure. And so they tend to be like, you're coming in from maybe clinical practice. You're a brilliant physician. Here you go.
Right.
And so they almost have to, by necessity and survival, have a quicker time to productivity.
Let's talk about that because, I mean, a lot of medical excellence teams and training teams will focus on the MSL role because you usually have a bunch of them and you've got some turn. They're always coming in new. And so you put program around it. How is that different for HQ? How are you accelerating that time to productivity for such a diverse group of such fewer people?
You've hit on the two key challenges. One, you're right. There's a lot more diverse roles, whereas the MSL, the science may change depending on the therapeutic area, but their core job activities remain the same. And it's MSL across the board. For HQ, we're typically talking about medical directors, medical leads, maybe a group medical lead, a medical head. And these folks are very specific in their job activities. That being said, there are common threads for things they need to execute. Things like materials review, setting up an ad board. What are the compliance regulations they need to be aware of, particularly when it comes to grants? Also, clinical, whatever the connection with clinical. So things like safety reviews or being introduced to our publications team or evidence generation team. There are, I'll call them red threads. And so that's what we look for in medical excellence. What are the common things across headquarter roles that we can help? So as part of that onboarding program, in the 2 weeks, typically post day one, we go through high level. And then similarly, as I think most onboarding programs do, you start off broad and then get very, very, very specific to the role. In medical excellence, we don't get to an N of one role, but we try and get pretty close. So we do medical onboarding, and then we have what we call micro journeys. If you're a field person, you go down a separate micro journey. If you're an HQ person, you go down this micro journey.
Wow.
And it just provides those sorts of things. For example, field does not typically set up ad boards, but HQ does. And there's a lot of rules and regulations and best practices that HQ folks would want to know. And so that's part of their micro journey.
So walk me through how you could possibly manage micro journeys across multiple roles, multiple people starting at different times at scale. Like what do you have to put in place in order to possibly keep all of this on the rails?
First and foremost, a incredibly effective, capable, and smart onboarding lead, which I am lucky enough to have. Somebody who owns it. If you have a RACI matrix, that's priority number one. Who is accountable for that? For us doing it at scale, the way we've done the micro journeys is creating evergreen-ish documents. And the reason I say ish is we all know that things change all the time. And so somebody that's also responsible or accountable for the maintenance. But having these documents that live as an on-demand resource, and that's where we get some ability to scale. So if you have, let's say we have 20 new hires in HQ this year, and you're right, they're all starting in some 2-week increments. Our onboarding lead is able to provide them that medical affairs onboarding. And then for the micro journey, it's very much self-serve.
Okay.
Meaning, Scott, you're a new medical director. I am here to support you. Here's your micro journey as this, whether it's an e-learning module or a PowerPoint slides, it doesn't have to be fancy. It just has to be user-friendly.
Okay.
And so if you're a new medical director, here is this resource. I would prioritize as a medical director, the ad boards and the material reviews. If you're a medical head, I would prioritize the people management pieces. And so it has that little a la carte, on demand, what do you need with some guidance.
Okay. So you said that you have an owner. who has to own this type of program? I mean, it seems like there's this interesting balance between it being very process heavy, same thing day in, day out. Like you have to keep the trains running, but you also need somebody who can build and design the track system. Like who is that?
Uh, Scott, this is such a great question because this is always the tension that probably anybody that's been in medical excellence is, I feel like, a perennial, frustration issue. Because you're right, our onboarding lead is living her professional life in almost these 2-week increments. And I say 2 weeks at AstraZeneca, that's how the HR cycle goes, and that's where the start date. So you really live and die by those. And so it is very process heavy. All right, I'm going to implement this, wash, rinse, repeat.
Yeah.
On the other hand, 2 key elements that are critical for our onboarding success is you have somebody in that role that can immediately gain the trust and respect of your new hires. For example, when you come as a new hire on day 1 and you're being introduced by HR or to these different systems, you probably have a lot of respect for them because that is their job. HR knows, I go to HR when I need to know the policies or people support resources. They know, and it's wonderful. And so for that first day, great. On day 2, you're now ready for getting, again, a little bit more specific. My role is in medical affairs. I want and need somebody that has lived and breathed medical affairs. Because let's do the thought experiment. If you outsourced onboarding to somebody who was just really great at process, and I came on in the first day and say, hey, I've never done your job before, but I'm about to teach you all the resources that you're going to need to do your job.
Yeah.
It doesn't compute. So it is a challenge. You need somebody that has the gravitas, has done the job, knows what is important, and can help guide new hires.
Okay.
But it's going to be a challenge to keep them excited and motivated because there is a lot of repetition in the job.
If someone asks you, how do you do it then? How do you keep somebody who's needs to be at that level where they are director? They probably, let's say they're at least an executive MSL, if not a manager level or director level within that organization to have that experience. How do you keep them motivated to do the running on the rails part of the job?
It's always going to be person dependent of what really motivates an individual. In my case, having somebody be able to really explore different principles of adult learning, whether it's science or process, those principles still apply. How do you inject fun into onboarding is also something that can be motivating because some people have been through horrific onboarding programs that were very much I'm going to look down at my slides and just give you all the information. And they're motivated by fixing that for others. Also, the opportunity to get involved in more leadership activities, because if you are going to onboard a medical head, for example, you're going to want to know what is the latest launch readiness plan. And so the opportunity to really be able to jump into pretty high level discussions, if for nothing else, awareness, but also hopefully, ideally input is also, I found, a motivating factor.
So let's say we have this program we want to implement. What are the challenges we're going to run into? What are the big challenges to implementation of such a robust onboarding?
3 things. Time, and time. So make sure that managers reserve the time. And this is a concept we refer to in our onboarding program as protected time.
Okay.
Time from mentors. This is a critical part of an onboarding program as well. And then I'm going to say time from the new hires themselves. So to dig into those 3, so time from the managers. When we first rolled out our formal onboarding program, we emphasized this concept of protected time. One of the challenges we found for HQ new hires specifically was that they would go through their day 1 orientation and then essentially say, all right, I'm going to add 60 recurring calendar invites to your calendar.
Yes.
And oh, by the way, here's our learning platform where you can do some e-learnings. And the need is so great that we need you up and running. So I'm just going to start pulling you into these meetings and kind of throw you into the deep end, so
Okay.
to speak. So for protected time, this was the idea that, as with most things, and I know the phrase is an ounce of prevention is worth a pound of cure, but in this case, an ounce of a little upfront time is worth a large amount of downstream effectiveness. So in this case, we made the argument to our managers, do not put any additional calendar invites on your new hires' calendars for X amount of time. And again, we had the 3 different bucket model. If it's somebody who's been in pharma and medical affairs before, we asked for 60% protected time in that first month. If it's somebody who's never been in pharma or medical affairs, we asked for 90%.
Wow.
Reason being that if you get in the first month, if you give them that protected time for us to review, us meaning medical excellence onboarding, for us to review processes, introduce them to what is an ad board. Imagine you're a clinician who has been brilliant at treating patients. You have had the authority to make decisions yourself in the best interest of your patient. Now you're coming into pharma. There's process, there's compliance. You can't make a decision by yourself unless you've gone through X, Y, or Z approvals. It's very different. Really helping people go through that is important. Not to mention, oh, by the way, you need to learn this entire therapeutic area if that's a new space for you. And so going through all of the science. And so that's where I say time from the managers is critical.
Okay.
And their time commitment to the new hire, say protected time, and then also a little bit of time from them, making sure they're having regular touch points, that they've identified some specific role-specific things that medical excellence can't do. It's very unique to this individual. Before I move on, any thoughts on that manager time? Because I saw your face light up. Was there something?
I was just picturing, right? I posted the position because I needed it. I through whatever approval. So I probably, by the time this person started, I'd wanted them 2 months earlier.
100%.
So how do you get buy-in? How did you get championship from the medical leaders within the organization to actually withstand another month of I can't actually offload anything that's been building up?
A huge challenge. And 2 things. One is data and 2 classic storytelling techniques. So one, the data is that time to productivity.
Okay.
Reserve that first month and I can get you where they're executing 100% quicker. So again, that kind of a little bit upfront investment will pay off in the long term. So if they're willing to do that, they get the payoff in the long run. The second is that storytelling technique. So most managers have been in that scenario where a new hire is in a pretty high level meeting. Because again, we're talking about HQ folks. And so helping lead strategy. And, if they're a pretty bold person, maybe they're raising their hand and asking, wait, what does AZ stand for? And you've never been so embarrassed. How did this happen? And so using those kind of techniques of you don't want this to happen. And if you allow us that protected time, we will ensure it doesn't.
Okay.
And to also be practical, those 3 buckets really helped because if it's somebody who's coming from pharma and medical affairs, they've been down this road before. They just need to know the company's specific aspects of it. So that's why we asked for 60% time. Hey, you need them to, what is your big priority? ASCO's coming up, ESMO. Sure, get them to pull in. They've probably done that before. Let us just help them with Congress excellence planning the AZ way.
Okay.
We try and compromise and find the right fit for the individual at scale. And so that's always the challenge. So that's why we do the buckets. We can't do an N of 1, but what can we do?
Neat. It seems like when you're first starting a program like this, you would have to rely more on the storytelling technique until you have some measurements to point at. So let's deep dive into the measurements here, right? You talked about time to productivity a little bit. What are those key measurements and how do you go about measuring them?
Great question. Sorry.
It sounds like, especially when you're first starting a program, you have to rely even more on the storytelling because you don't have measures that you could maybe point to for you. You could go get best practices, so let's talk about what those measures are. You talked about time to productivity, but what are those other measures that you use to evaluate an effective onboarding programs?
Sure. One of the classics is retention, which I think is oftentimes what inspires a discussion about onboarding because there's been myriad of studies, typically run by HR, that a good onboarding program results in people staying longer.
Okay.
And I've found that you can also look at two different retention metrics. One is overall retention, but two is also how many people leave in the first year,
Okay.
because that I find is also a really strong reflection of onboarding. You can imagine if somebody is very excited, they've got the
Yeah.
job offer, they start and then have no guidance, no support. They're probably very frustrated very quickly and have that feeling of, oh, I've made a terrible mistake.
Mhm.
And they're going to look to leave in the first year.
Okay.
So those are pretty typical metrics to look at for retention. But the trick is, being a medical excellence person, we don't fully own onboarding. Of course, a large part is also HR and IT related.
Mhm.
So retention is one thing, but there's other forces at play.
Right.
So one of the other things that we can look at and that we have qualitatively is compliance. I'll call them red flags.
Okay.
So this also really plays into storytelling. We had a situation, for example, where there was, and I can't even remember the specifics, but it was essentially there was a grant that didn't follow the right process, and it got flagged before anything untoward happened. But the idea being, this person just didn't know the right process and had moved forward with what she knew from her old company,
Mhm.
which is fine, but it wasn't per AZ's SOP, and so it
Yep.
got flagged. And when that happens, as of course, it generates a lot of paperwork.
Yeah.
First, you have to fix the issue, then a remediation plan, and talk about storytelling. Say, hey, has this ever happened to you or something like it?
Yeah.
Can we not have that happen? Which managers are, yes, please.
Yep.
And then two, that really creates that effective story, because if you're talking to a group of managers and that manager was in the room when compliance reached out and said, we have an issue here,
Yeah.
nobody wants to be in that scenario. And so we found that to also be effective. And you can measure that. How many red flags did we have pre-post onboarding program?
Excellent. So just, I don't know if you know the numbers off the top of your head, but like what you think about first year retention, what have you seen? Like, is it a big problem that we're trying to resolve?
So these are the things where having the benchmarks is really important, because for retention, you would look at how many people left in the last year, or what's the average time that somebody stays with AZ. And the way that you move the needle, we're talking 1-2%. Because I'm thinking of my scientific method here, if you isolate your variables to just your medical excellence onboarding program, which is what we were actually able to do. When we implemented our onboarding program, nothing changed about HR's new hire orientation, nothing changed about IT. So it was truly just pre-post. And so far, we've been able to show a 1 to a 1.5% reduction
Wow.
in the dropout rate, or I should say, I guess the other way of saying it is 1.5% increase in our retention rate. Pretty good, considering this was just one program change about onboarding. Many, many, many things also go into play. And I shouldn't have said we isolated the variable, because now as soon as I've said that, I thought managers changed and our structure was changing. All those things come into play.
Within reason.
Within reason.
Systematically.
So keeping expectations, if you're even able to move the needle on retention, that's really impressive.
Going back to something earlier you said that I think is a huge opportunity on that retention is that pre-first day retention. I have seen and just talked to so many leaders where, especially since COVID, people are accepting an offer, and then weeks later, before they start, they get that other offer that they were expecting and not showing up day one.
Wow, I apparently have had the privilege of not having that happen, but I can appreciate that. Yeah, you work across so many companies, you've probably seen that. So when you've seen that happen, do you attribute it to just the lack of communication, missed opportunities?
I find that when you have the relationship, when you started a relationship with somebody, it's harder to walk away from it. When the only thing you've had was the congratulations letter, and then now I have a second congratulations letter, It makes it a lot easier to walk away. I'm not actually starting to feel like you've invested in me yet. I don't feel like that I've made it really a commitment until I get there. And I'm seeing this mostly ex-US, which partly comes from the very long tenure periods that where you have to tender your resignation, and no, there's a lot more opportunity for that to occur.
Oh, that's a great point. Yeah, like I said, I've been in privilege of not really having to deal with that, but good to know because I'm sure it could come up at any moment.
Yeah, but I love that it's connected back to the importance of the pre-day one engagement. Okay, so we've got retention, we've got the compliance red flags, time to productivity. You've got a kind of a ongoing measure of that, but that sounds like it is your flagship, like my one key indicator. How do you monitor that over time?
All those metrics are specifically time to productivity. We do a yearly survey that's been working for us because we're more now mature in our program. But generally speaking, we take everybody who is a new hire within that year, all their respective managers, they get 2 separate surveys and say, thinking about your onboarding experience or thinking about your new hires this year, who, by the way, were X, Y, and Z, in case we need to remind you, because sometimes you have people like, oh, no, they've been here for years. Actually, it's only been 3 months. And just, again, it's qualitative because it's their own reflections, but a yearly survey has helped us tell the story. At least now we have 3 years worth of data. Here's what it was pre, saw a dramatic increase, and then year over year, we saw small increases.
Nice. That's awesome.
Or for time to productivity, I guess decreases, but increase in
Yeah.
satisfaction, increase in retention, and then also just anecdotally looking at those compliance red flags of this was the number and dramatic reduction.
Very cool. All right. So I'm going to ask you just one more question, and it's a little bit broader than onboarding. So, and I love discussing this with medical excellence leaders. So medical excellence is this role that helps build and design and improve the medical teams. In order for you to do that, you need to remain a little further ahead than your organization on some key areas. What are you focused on personally for you and your team's development? What are you trying to learn right now so that you remain that relevant thought partner that stays ahead and brings more value to medical affairs every year?
That's such a good question. And I'm intrigued by it because I agree with you and then I disagree with you. So on the parts where I agree with you on the topics of digital innovation, omni-channel, the leads in our medical excellence team, that you're right, they have to be subject matter experts. They're staying on top of things, going to conferences, meeting with other thought leaders, and really serving that kind of consultative role to our medical affairs leaders.
Mm-hmm.
On the topic of onboarding, though, this is where I might disagree with you because one of the things that I've found is that onboarding is so foundational. I consider it a basics of medical excellence.
Okay.
And so, because to your point exactly, our medical affairs leaders are needing to just be, the pace of work is just so fast and constantly accelerating. The ability to, it's not going to be the right phrase, but essentially offload onboarding. And I mean that in the most loving way, meaning they recognize how important onboarding is, but also that they don't have the expertise. That medical excellence brings the adult learning principles, knows the changes in compliance and SOPs, things that they really don't have time, probably, nor do they want to. They're medical leaders because they're into the science, the data. They're up to date on that. But the ability to say, medical excellence, you thrive in this environment, in this onboarding. Could you please onboard my new hire so that I can get them up to speed even quicker? So I have found that for onboarding, we have dedicated a lot of time to making this happen, but we're recognized for providing a really essential and foundational service.
Awesome.
And so there isn't necessarily a need to, we need to stay on top or be up on the latest. I think that naturally happens for anybody's area of expertise. But unlike digital innovation or Omni, where they're truly coming to us and say, all right, you got to be cutting edge. Onboarding is more, hey, we value your experience and expertise in this area. Here, take it.
Got it. Yeah. I think that there's only 4 ingredients that a medical excellence team has to make an impact. It's process, technology, capability or training, and support. And if you pull in that support lever and say, we're going to take work off of you so you can focus on other things, that adds so much value to the team, whether it's onboarding or project management or processing, material review, whatever it is. It's amazing how much relief that the organization gets. But you did just mention a handful of things that if anybody listening is responsible for onboarding, that you really can and should prioritize in your development, right? Adult learning principles, right? There, the changes, the understanding of kind of things like active recall and some of the processes and tools you can put in place are so cutting edge. And I mean, I shared this with you and your team actually when I came to visit about my personal knowledge management system, where going through 100 books and actually remembering the stuff that you learned and getting it to recalls. I think that we didn't get into it, and I don't think we have time now, but really how to do all this in this remote environment, right? And so kind of remote engagement sounds like this huge area that, especially post COVID, there's tons of new research, tons of new tools, tons of processes. And then I think the last one that I would love to maybe do another time, maybe with more onboarding people, is around connecting all these changes to onboarding back to the rest of the organization. It's amazing to me how many times we update onboarding programs and never go back to teach the hundreds of people who already learned it and then it changed. And like keep all that in sync. I think that there's some really interesting things that onboarding lead is often the trigger for that can help expand their influence in the organization.
Oh my God. Yeah, that's a whole nother topic. And I think, Michael Kahn could probably give you a whole lecture. At least he's been my guru as far as change management. And if you're going to change whether it's onboarding or other, you need to have a 10 times better program that you're moving to, because the cost of the change itself. I mean, we've had our onboarding program now in place for over 2 years. And you still have people, and this is just the nature of onboarding in particular. They haven't had maybe a new hire in that time.
Mm-hmm.
So you haven't caught everybody, just the nature of being busy. And, oh yeah, I onboarded somebody at the beginning of the 2-year time, but now I've forgotten because it's not something I do every day.
Right.
And so, to change an onboarding program is actually pretty momentous and a very heavy lift. And so, as Michael would say, unless there's a 10 times benefit and the new onboarding program is just so amazing, it's probably not worth the change management effort.
100%. And that's an amazing Michaelism. And I will put a link to Michael's episode in the show notes right there. And Stacey, you are so generous with your time, with your expertise. You're involved in maps and going to speaking at conferences. If people have follow-up questions, how is the best way to get in touch with you? Would that be LinkedIn or?
LinkedIn, please. Yeah, I love LinkedIn.
I'll put your LinkedIn information in the show notes. Again, Stacey, you're just a breath of fresh air every time we talk. So passionate about what you do. And I'm really looking forward to further conversations.
Scott, I know we're at time, but talking about passion, we didn't get to talk about the one piece of onboarding that I feel like might be missing from some people. And you said the key elements of medical excellence. You mentioned support. And as I was listening to you, that's what he meant when you talked about taking work off of people. Yeah. But I was also thinking of emotional support. I'm revealing my green energy here. Okay. So when I introduce onboarding, I typically talk about Maslow's hierarchy of needs and, of course, food, water, shelter, but also kind of that safety and security. And so for any onboarding program, I try to always emphasize that emotional, like you said, validation that I've made the right choice. I feel supported emotionally, also work-wise, but also togetherness. Oftentimes when you're joining a team, one of the key elements of our onboarding program, is going to sound so silly, but is in that very first week, our new hires get a box of AZ swag. And also we do a couple of handwritten notes, whether for our onboarding lead or from our VP of US Medical Affairs, just saying, we're so glad you're part of the team. You bring a unique set of skills and here's your t-shirt, AZ pens.
Nice.
Everybody loves swag. There's no doubt about it. But getting it that first week, feeling part of a family, And then part of our onboarding program is not just here's all this information and here's how you should go through it. We have live moderated sessions where our onboarding lead is meeting with you, Scott Thompson, if you're our new hire, and saying, welcome, I am Stacy. You can Teams message me, email me at any time if you have questions. But you also have your mentor. We didn't even get into the mentoring program.
Sure.
And you have your manager. So talk about a trifecta of support if each of those three people do it well. So I just wanted to make sure I emphasize that onboarding is not just about the resources or making sure time to productivity. All of those things are important to the business. But we're also talking about people and making sure that they feel that they've been set up for success is equally, if not more important.
I can't think of any better message to leave everybody with. That was a master class right there. And I think we just hit the most repeated section of our listening graphs.
Okay.
Thank you for not letting that go before we hung up. Really appreciate it.
Okay, perfect. I'm glad, hopefully. And if anybody has great ideas of how they foster that, please reach out because I would love to hear it.
Awesome. Let's get a whole bunch of suggestions in the show notes. Everybody comment, send some love to Stacy, share your ideas. And again, thank you so much for joining us. This was so much fun.
Thanks, Scott.